Welcome back. In this video, I'm going to show you the equipment that I actually purchased in order to recover from my hip replacement surgery that I'll be having on tomorrow. A lot of this equipment I may have purchased years ago because I've been dealing with this hip issue for a while. But regardless, it's going to be useful, especially during my recovery period. And so I'm just going to go ahead and start showing you some of the items. Here we have a walker with wheels, and this was actually provided by the insurance company. I went ahead and I purchased a retractable or a folding cane because I'm not sure how long I'm going to be using the walker. My goal would be hopefully to progress from the walker to the cane within 3 to 5 days. I'm not trying to push it, but I do know that I usually heal pretty fast, so I'm hoping that I'll be able to transition within the first week. If you can see this is actually a massage table, but what I've been finding is that it's a lot easier to do some of my exercises for my hip on this massage table. So I'm using it right now as like a workbench. It's wider, it has a cushion, it has so it's a little more comfortable. And because I have to do heel slides, moving my leg up and down, that tray right there that has the stretching band, the green stretching band on it, I'm actually going to use that tray under my heel, and it's going to be able to slide easier on this table, on this massage table, than it would on an actual bed. The backpack isn't really for recovery, it's just that for tomorrow, we have to bring the wheelchair. The backpack really isn't used for recovery. Tomorrow we have to be able to bring the walker with wheels. And I just feel that the person who's going to be assisting me, my surgery companion, I feel that it'd be easier for her to tote the backpack and the walker than, maybe like a luggage case or whatever. So she could just put that on her back, and then the walker actually folds and she'll be able to tote both. I do have a shower bench down there that I have not yet assembled. So family members and friends, when you come over, you've been asking me, what can you do to help me? Help me assemble some of this stuff because your girl is tired. All right, and so this is actually the rail that's hanging over the massage table. That's actually a side rail that is really easy to assemble. And whenever I show you the picture of my room, you're going to be able to see how I use it on my queen size bed. And that's going to help me get in and out of the bed, especially since my bed is at an elevated height. So we talked about the tray table and the stretch band. We have the toilet cushion, and so that's going to raise the level of the toilet. I went ahead and I decided to get the toilet seat cushion along with the toilet safety rails. Versus getting the toilet safety rail with the cushion connected together, because that would have required assembly and taking off the toilet seat, etc. And I just don't have the time nor the manpower for that right now. Right. So the second tray, cafeteria tray, and I have links to everything in the description area. The second cafeteria tray is going to be what my son can serve my items on, because I may only want soft things like soup, etc. And I don't want him bringing a bowl of hot soup to me in his hands, so he can just put those items on the tray and then present it to me. Pretty much the only medicine that I can take pre-op is going to be Tylenol, which sucks because Tylenol does not help with my hip or my back pain. Only Motrin does, and turmeric, and I can't take either of those right now. The Colace is a stool softener. I also bought some Metamucil or some Miralax, excuse me, because the pain medications that they usually give you post-op, they do cause constipation. And of course, water. So I have a lot of bottles of water. And the reason why I have that red applesauce there is because before surgery, you're not supposed to eat or drink anything that's red after surgery either, because if you vomit and the doctor doesn't know if it's your stomach, if you're actually bleeding, or if it's something that you ate. So yes, I do have regular applesauce. I love strawberry applesauce, but I can't have it before surgery. And as a matter of fact, I can't have anything to eat or drink after midnight tonight. In the back, we have our chlorhexidine. That's going to be what I need to bathe in. So tonight I will be showering. I'll wash my hair. I have locks, so I'll braid my locks down after I wash my hair. I'll plait them together, and then I have to do a bath tonight. My sheets are clean. You have to make sure you have clean linens. With this chlorhexidine, that particular bath, you leave it on your body for about 2 minutes before you rinse it off. You can't put any creams or any lotions on top. You can't shave, so no shaving of your legs. And then I have to repeat that same process in the morning. Take another chlorhexidine bath before surgery. Went to Publix, got all of my prescriptions. They were pretty, I was in and out. I'm just not used to having so many prescriptions. So that's 5 different containers of pills there, and I make a much better nurse than I do a patient. All right, so this is my hip chair. It is an elevated chair with handles. It has screws, y'all, and I'm tired. I don't even know where my toolkit is, so I will not be assembling this. Friends, family, when you come over, bring a toolkit with you, because Eunice is not assembling the chair, the hip chair, but she definitely needs it. The hip replacement education guide, it had a lot of information in it, and that's something that the surgeon provided his team. They have actually already pre-scheduled my appointments, you all. They worked really hard. They're a well-oiled machine in order to make sure that their patients recover. I've watched my online videos so I've already received some of my patient education. I purchased a new Fire Stick, and pretty much we don't have cable, so we stream a whole bunch. We watch a lot of YouTube, etc. And I just realized that this room did not have any entertainment. It had a TV but no entertainment. So we have a new Fire Stick for this room. This is the Plasma Wave. It's like a DVT, deep vein thrombosis, or blood clot prevention device. So it's going to be those little squeezy, those things they put on your legs, but the insurance company or the surgeon has already sent me mine. So I'll have that for a pre-op after the surgery. I have my cold pack. I have my hip replacement kit, and that comes with my grabber tool, my sock aid, my dressing stick. It has a lifter strap to help lift my leg if I need assistance getting in and out the bed. And then it also has a soft bath sponge. Oh, this right here, because I love for my house to smell amazing. And since I won't be able to, wear any perfumes or anything for a little bit, and I'm not too sure of when I'm going to feel like showering, because I will have a dressing in place for a few days that's attached to a portable wound vac. And so that is called Beach Please. So yes, I need some Beach Please. And then I have Cuddle Up. And this one down here, the Better Homes and Gardens, they're jasmine, and I think it's called Ling Ling. That particular candle wax, I just love the scent of it. And so whenever I walk in tomorrow after surgery, my house is going to smell wonderful because aromatherapy, music, all that's going to help aid in the healing process. And again, this is everything I have. I also have like a little bike so I can start exercising, but I have a gym membership too. And then I have the wonderful Nikki the trainer, so whenever I'm released from therapy, I have somebody I can work out with who understands joints and also has worked with other people who have orthopedic injuries. So these are those safety rails, and they're really easy to assemble, and pretty much all you do is you lift your mattress and you slide them through. They're a good 3 feet under the bed, so it's pretty secure. So between your body weight and the weight of the mattress, I feel comfortable getting in and out of the bed. And I don't know if you can see it over there, but I have a little extension cord because I do plan on working. I still have to do some computer work, even though I will be bedbound, or at least not as active as I'm used to being. And so having that little extension cord right there is going to help me out so I can charge my phone, and do other things. So this is my complete setup, everybody. All right, everybody. Again, this is Eunice Mathis, registered nurse, owner of Florida Training Academy, preparing for my hip surgery, which is tomorrow. So when you see me walking with the gold cane, just know that I am still making progress. It's going to take me a few weeks to heal, but at the end of the day, I got to get back to work because I miss training my babies. So everybody have a blessed day. All right, I'll see you. Don't forget that health is wealth. So let's just stay healthy. Let's keep moving. And above all, let's keep taking care of each other. Have a blessed day, everybody.